So this video is testing for the causes of low back pain, and it consists of 4 different sections: the inspection, palpation, provocative tests, and neuro tests. This is Matthew. He's going to be assisting me to make this video. All right, so you're having low back pain?
Yeah.
Most low back pain is caused by L4 to S1, so we're primarily testing those nerves. All right, are you ready to go?
Yes.
All right, so first I'll have you stand up, and I'm going to look at his back. I want to see a little bit of going in. It shouldn't be flat, and it shouldn't be extreme lordosis. It should just be mild lordosis, and you don't want to see bending over this way either for kyphosis. Now I'll have you bend forward and touch your toes. So you'll want to look at the back and see if one side is higher than the other and if the spine looks straight. So you're looking for any kind of curvature like scoliosis. All right, so I'll have you stand back up. Now I'm going to look at your range of motion. So I'll have you turn side to side, and I'll have you bend backwards, and I will have you bend side to side. So this is, you're looking at not only the range of motion, but also making sure that they're not having any pain as they do these exercises. I'll have you sit back down. So now I am going to palpate. So I'll have you turn this way. So you want to palpate each vertebra and see if there's any pain or if you notice any defects, to see if the pain is maybe nerve or at the actual vertebra. And then you want to palpate the paraspinous muscles just to make sure that those aren't painful and the source of the pain. Any pain with that? All right. Provocative test. So what we'll do first is the tripod test. So I will lift his leg up. Any pain with that, sir?
No.
Now, what would the patient do if he did have pain? Do you know?
Yeah.
He would brace himself, which is the tripod sign. So that would be positive. And that is testing L5 to S2 to see if there's any nerve pain there. Okay, next, you're going to verify that with the supine straight leg test. So I'll have you lay down. So this test is pretty easy. All you need to do is raise their leg from 30 to 60 degrees. Any pain, sir?
No.
And then you want to flex the foot. Any pain?
No.
So you want to flex the foot at about 30. All right, I'll have you lay on your tummy, and we are going to do the reverse straight leg or the femoral stretch, and this is testing L2 to L4. So for this test, we are going to do his knee at 90 degrees. We're going to hold under the knee and pull up. Any pain with that?
No.
And if they had pain, it would be in the anterior thigh area here. All right, so now I'll have you lay back on your back, and we are going to test motor first. So L4, we do the bent knee kick. So I'll have you kick against my hand. Okay, so that's testing L4. And of course, you want to check both sides and compare the strength. And that was a 5 out of 5. So L5, I'm going to have you dorsiflex your foot. So push up against me. Good. And then S1, I'm going to have you plantar flex. Good. 5 out of 5 strength on both sides. And then I'm going to do the sensory test to test the sensation in his legs. So for L4, you're going to test the anterior lateral thigh. And then for L5, you're going to test between the first and second toe. And then for S1, you're going to test the lateral foot. Okay, and then what we're going to do finally while he's here is reflexes. So L4, we're going to test the plantar reflex, or patellar. And remember that we want to see the muscle move here more than we need to actually see movement. So I'm going to hit, And I saw recruitment +2 right there. And then I'm going to do the medial hamstring for L5. So I saw some movement there. So that was L5, and I saw movement. And then finally, we are going to do the Achilles reflex. So I'm going to have you sit just like that, and I'm just going to kind of push the foot up this way, and then I'm going to get that Achilles tendon with the reflex hammer. So +2, great movement. The last test that we would have him do is have him walk on his toes and walk on his heels. So the tests we're testing for L4 when he walks on his heels, and then S1 when he walks on his toes. And if there is weakness on either side, that foot would droop and not be able to walk on toes or heels. Thank you.